The purpose of the surgery is to fuse two or more vertebral bones of your lower back into one. This is achieved by tricking your body into thinking the individual vertebral bones are broken, at which point your body attempts to heal this break into one bone. The procedure begins with the surgeon making an incision along the midline of the patient's lower back. The back muscles are gently moved to the side so the spine is visible. Usually a fusion is performed together with the laminectomy procedure. As explained in a prior video, laminectomy removes bony pressure on the nerve sac. Fusion can be necessary after removal of stabilizing bony anatomy to solve complaints related to fractures, herniations, infections, or tumors. A combination of screws and rods are used to achieve this stabilization of the spine. The screws can be placed in the pedicles, which are the strongest part of the spine. Additional bone graft is placed along the sides of the vertebral bones. Posterior lumbar fusion generally runs from 2 to 5 hours. Traditionally, patients were admitted to the hospital for a few days.
I have always had an issue with anesthesia and pain medication. So going into this spinal fusion surgery, I was very concerned about vomiting. Basically, my back is being broken, taken apart, and put back at like a bionicle or something. And the last thing that you want to do is to be upchucking. So I had a good talk with them about it. And I was assured that they will give me everything that I needed and hopefully all will be well. So I go in, have the surgery, and I wake up in the PACU. I think maybe 4 hours later. And my body was like, what the heck did you do? No, ma'am, don't think so. What is this? Get it out. Can you imagine? I just had the spine surgery and I started throwing up and heaving and throwing up. I felt more concerned about other people that were in the PACU because who wants to hear somebody vomit? Anyway, vomit. It was terrible. It went on and on and on. So I didn't leave the PACU until like 4 hours later. They took out all the IV and any of the other medications that I had in, and another doctor came in and said, okay, well, let's try fentanyl, a PCA pump, where you self-administer it by pressing a button with a 10-minute limit or whatever. So they put that in, and it seemed like it had subsided. So, okay, at 8:30, they moved me upstairs to the ward. Once on the ward, I met the nurse who was going to take care of me that night, a male. His name was Paul. He was an older gentleman, very kind, very professional. But I was like, why do I have to have a male? It just, I don't know, it's something about it just because I didn't have on any underwear, first of all. And then I had to use the bathroom. Now, I know in the States, you wake up with a catheter. They ain't worried about a catheter here. They're like, well, boo-boo. So then my call button wasn't working, so I couldn't call him for a bedpan. So he ended up giving me the telephone number because he saw I had my cell phone. So I would have to use my cell phone to call the nurse's station to ask for anything that I needed. That's just, this is a new hospital. Okay, I'm just saying, whatever. Okay. Anyway, he was very attentive and he made it seem less uncomfortable that he was a male, but I was still happy that, the garden was pruned and trimmed and all that, because you still have to get a bedpan underneath you, and it's not pleasant. And then you're sitting there like saying, please don't let this go all over the place, because only females would know what that's like. It's like, oh. And then Paul had to come back and take the bedpan away, and I don't know, I don't know what that makes me, but I don't know, but whatever. But he was very, very good, and I was very impressed with his care. He was very good. So I had the PCA pump that night, and then they hooked me up to another IV where they started giving me antibiotics, and I started to feel a little queasy after those. I already can't have penicillin, so they gave me a different one, and that didn't make me feel very good either, but I didn't throw up, so yay for me, victory. So then they put these foot pumps on your feet, and they just inflate. One inflates, goes down, then like 10-12 seconds later the other one. That's to keep the circulation good in your feet, to hope you wouldn't get any blood clots. And I'm here looking at the IV antibiotics. I'm looking at the PCA pump that I have attached to me the fentanyl, and I'm looking at my foot, and I'm like, so if I was to go straight home, I wouldn't have access to any of this stuff. So I'm just not understanding. Whatever. I just can't understand it. But anyway, so the next morning, the physios came in to help me get up for the first time, because I hadn't been up, and I used a bedpan like 3 times that night. And I thought about like 10 minutes before they arrived, I was thinking maybe I should call the nurse and ask for a bedpan, whatever. I didn't, just because it didn't feel like it was an emergency. So 2 male physios, yay, me. 2 male physios come in to get me out of the bed. So they put on my back. I have my back brace on now. You see when I stand up or whatever. My shirt is so filthy because I dropped breakfast on me, but I don't care. So they pull the corset on me, and then you have to like log roll. You roll over to your side, and then you push up to a sitting position. You sit there for a bit, and you wait until the dizziness subsides if you have that. I had a little bit. Okay, fine. So then I still don't have any underwear on, and I'm like, oh my God, do I make it more uncomfortable by insisting on female physio? Whatever. Okay, so here I am, always taught never inconvenience anybody else, always inconvenience yourself. That's how I was taught. That's how I grew up. So they try to get me up to standing position, and as soon as they got me up, I felt something warm on my leg. I'm like, what is that? Well, my bladder decided that it was going to void on its own with no warning, no indication to me. So I've got these 2 guys standing on my side, urine running down my legs. Couldn't stop it. It was just coming out because I couldn't even feel anything. I cannot tell you how mortifying that was, because this can't be happening. That would have been a good moment to disassociate. So they were like, you know the spiel. Don't worry, it's nothing we haven't seen before. And then they went and told the nurse that there were some incontinence issues. Of all the things I had researched, and I looked on videos on YouTube, because it was not like I could find anything here about the surgery, no one had talked about that as something that could happen and to watch out for. So they changed my support hose and my hospital socks, and they put on these little booties that I actually wore from the hospital, and they're getting really ragged. They're cheaply made, but they put these on me, and I really like them because they're sock-like material that's very pilly right now, but the bottom is non-skid, and they're awesome. I even sleep in them, so if I have to, anyway. So they put those on me, and they said, okay, well, let's try it again. I said, okay, let's go. They said, this time, we'll just take you just as far as the bathroom and whatever. So they got me up again, and it happened again. It's just running out of me, saying, hey, baby, we're escaping the plastic zoo up there or whatever. And anyway, so they got me to the toilet, helped me sit down, 2 men. And I wish I could have flushed myself at that point. What the hell? Anyway, so people, that could happen. So if you're getting type of surgery, well, I guess what happened, like, it didn't help when they pulled the corset. I would have thought, you would have thought it was medieval times or whatever, because they pulled it so tight. So the doctor had come in and he said, of course, oh, don't worry, your nerves have been compressed for so long, and now that they've been released, they're a little bit excitable and they're doing their own little thing. It might take some time for it to get back to normal, but just to keep an eye on it to make sure it doesn't happen again, and if it does, let us know, Yeah, I'm like, yeah, whatever. I should have known that before. Anyway, so yeah, be prepared for some, as I tell my dog when he has accidents, some pee-pee naughty could happen. So anyway, I got washed up in the bathroom to clean me up and all that stuff. And I hadn't been using the PCA fentanyl pump a lot. The first time it freaked me out when I pressed the button and it says, oh, releasing. And then you see things in micrograms and milliliters. And it took forever. And I'm like, I hope whoever put this in my arm did it right, because I don't want to be dying for some fentanyl overdose. And it took forever. And I'm like, I started to get a little panicky. I'm like, do I rip this out? Like, okay, just panic. Don't panic. Don't panic. Okay, so I'm still here, so it didn't kill me. So, you hear so much bad things about fentanyl, but fentanyl started in the hospitals. There's any of these fools that took it out and are using it for, I don't know what they're doing, whatever. So I hadn't used that a whole lot during the night, and then I was sitting in the chair, and the hours in a hospital, go super slow. Is it in 5 minutes? 50? So then I'm sitting there thinking, okay, well, the physios got me the walker, and, I walked outside the room with it. It came back in, sat back down for a bit. It was very tiring. Got back up, did it again, sat back down. I'm like, so, you know what? I think I can go home on this second day. I don't need to stay here any longer, because it was going to drive me bananas. So the doctor came in and said that, you look so much better than you did yesterday. I'm like, no kidding. And I told him that I could probably go home. He says, I think so too. I think you're ready because, you're able to be mobile and you're not dizzy and you're not even using a whole lot of those pain medications for obvious reasons. And there you go. So I came home my husband picked me up Thursday lunchtime. So I went in Wednesday morning, had the fusion, and I got discharged Thursday lunchtime. And we came home. So I'm going to just talk about some other things that I have found useful in this process. And I think I might put together a PDF that I can link in my description so that if anyone wants to download it, then they can see the things that I put on there. And I'll try to put maybe some pictures and some other links to like Amazon or wherever, because, you can get it overseas so much easier and whatever. So I think that's what the next video is going to be about, the things that I'm using right now to help me get through the initial week of recovery.